Hello, and thank you for joining us for today's webinar. My name is Jennifer McGovern, and I'm the Director of Marketing for the U.S. Commercial Business at Pattee Pharma America. On behalf of myself and my colleagues, I'm thrilled to have you here with us today to listen, learn, and share insights that are so important to our ALS community. During the next hour, we will hear from two experts in the world of ALS. Dr. Gary Pattee is a clinical neurologist at Bryan Physicians Network and an assistant professor at the University of Nebraska. Dr. Pattee will review the clinical data around our product, RADICAVA ORS, edaravone, and following his presentation, we'll have the privilege of hearing from Gwen Peterson, a dedicated ALS advocate, about her experience living with ALS and taking RADICAVA ORS. Throughout the presentation, we encourage you to submit any questions you may have. If you're viewing on a desktop, you can enter a question at any time in the black box on your screen. On mobile, simply click the question mark icon at the bottom of your screen to submit. At the end of the presentation, we'll do our best to address as many questions as we can about the information presented. So let's get started. And again, on behalf of TPA, thank you. Dr. Pattee?
Well, hello and welcome. Thank you to all who are joining me and others in our ALS community for this exciting and informative webinar event. As Jennifer mentioned, my name is Dr. Gary Pattee. I'm a clinical neurologist in Lincoln, Nebraska with the Bryan Physicians Network, also assistant professor, clinical instructor in the Department of Neurology at University of Nebraska Medical Center, as well as the co-MBA director for the Adult Muscular Dystrophy Association Clinic. I'm pleased to be here on behalf of Pattee Pharma America, or TPA, which strives as a company to make a difference in the lives of those living with ALS, and I share in that commitment. Today, I'd like to talk to you about RADICAVA ORS, which is an oral formulation of edaravone with a foundation of clinical evidence and real-world experience, a proven therapy truly built on solid ground. First, a few disclosures regarding today's program. As I mentioned, this program is sponsored by TPA, and I am being compensated for presenting on their behalf. All of the information I'll be presenting today is consistent with the approved product label, and I'll be speaking from my own personal experience at times as well. So a little bit about the medication. RADICAVA ORS is indicated for the treatment of amyotrophic lateral sclerosis, or ALS. It is contraindicated in patients who have a history of a hypersensitivity to the edaravone compound or any of the inactive ingredients of this product. Hypersensitivity reactions and anaphylactic reactions have occurred with this product. Now, there are some safety information points that we want to make clear, and I'll read through these for the audience. Number one, do not receive RADICAVA ORS if you are allergic to edaravone or any of the ingredients in RADICAVA ORS. Before you take RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA ORS will harm your unborn baby. If you're breastfeeding or plan to breastfeed, it also is not known if RADICAVA ORS passes into the breast milk. You and your healthcare provider should decide if you will receive a RADICAVA ORS or breastfeed. Be sure to tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. In addition, other side effects with RADICAVA ORS may cause some serious side effects, which include hypersensitivity or allergic reactions and sulfite allergic reactions. A few more points. Hypersensitivity reactions have happened in people receiving RADICAVA ORS and can happen after your medicine has been given. RADICAVA ORS contains sodium bisulfite that may cause a type of allergic reaction that can be serious and life-threatening is a concern. Sodium bisulfite can also cause less severe asthma episodes in some people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. That's why this is an important concern to bring up. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms with this medication: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itchy, or any asthma attack in people who have asthma. Your healthcare provider will then monitor you during treatment to watch for signs and symptoms of all the serious side effects, allergic reactions that we may see. And the most common of these side effects include bruising, problems with walking or gait disturbance, and headache. Now, these are not all the possible side effects of RADICAVA ORS. And as you can see on this slide, you can call your medical doctor for advice or report side effects to the FDA or the Shionogi Inc. Directly if you need to. So that full prescribing information and patient information is also found online. So any medical questions you may have should be directed to the TPA Medical Information Call Center, which is listed here on this slide, or you can visit the RADICAVA ORS website at radicavaors.com. To report any suspected adverse reactions, you can contact TPA directly or reach out to the FDA. So in today's program, we're going to talk about the clinical history behind RADICAVA ORS and how we arrived at where we are today. We'll also discuss the efficacy and safety of RADICAVA ORS, which is an oral formulation of a proven IV treatment. So let's begin with a little background. As I think everyone may be aware, ALS is a neurologic disease that can progress rapidly. And beginning treatment with an option like RADICAVA ORS can be an important step in managing one's condition. RADICAVA ORS is a 5 milliliter oral dose of a proven treatment, deeply rooted in clinical knowledge and legacy of RADICAVA, which is an IV formulation of edaravone. Let's talk now about the history of RADICAVA. RADICAVA has been evaluated in over 2 decades of clinical research, which includes 4 phase 3 clinical trials. It was approved by the FDA in 2017, and RADICAVA is the only treatment for ALS that met its primary endpoint in a pivotal phase 3 clinical trial. Let's talk further about that clinical trial, which ultimately led to RADICAVA's approval, and how RADICAVA was studied. First, in ALS, every point matters. Losing or keeping a single point on the revised ALS functional rating scale, or you'll see these initials ALS-FRS-R, can have a significant impact on those living with ALS. That's why the pivotal phase 3 clinical trial of RADICAVA was specifically designed to measure change in physical function assessed by this ALS-FRS-R scale. Now, this scale is considered the gold standard used to measure ALS disease progression and trial outcomes. It is a validated, questionnaire-based tool for evaluating change in physical function over time. On the ALS-FRS-R, the fewer points lost, the greater the physical function. ALS does progress at different rates for different people. The ALS-FRS-R measures how you are doing now and will help track disease progression in the future. The average rate of ALS-FRS-R decline is 1 point per month. For example, 1 point of functional loss in the ability to swallow could mean going from being able to eat enough on your own to needing supplemental tube feeding. A 1 point loss in the legs could mean going from being able to walk with some assistance to not being able to walk at all. So clearly, every single point on the scale matters in a very meaningful way. Now, in a few minutes, we'll discuss how RADICAVA may potentially slow disease progression by reducing the number of points lost on this ALS-FRS-R scale. Let's discuss the indications and contraindications of RADICAVA ORS and how RADICAVA ORS may help those living with ALS based on the pivotal trial of RADICAVA. Back to our discussion earlier on the importance of retaining points on this ALS-FRSR scale. Remember how important every single point can be. Now, while individual results may vary, patients who did not receive RADICAVA declined more rapidly in physical function, having lost an average of 2.49 points more than those who received RADICAVA, as this slide points out. Also, over 90% of the patients in each of these groups, treatment and placebo, were also being treated with riluzole. In the clinical study, RADICAVA slowed the loss of physical function as measured by the ALS-FRSR. At 24 weeks, or approximately 6 months, patients who did not receive RADICAVA declined more rapidly in physical function, having lost an average of 2.49 points more than those who received the RADICAVA. This included a 33% less decline in physical function versus placebo, which is a treatment containing no actual medicine. Now, a report on a survey of 65 members of the Northeast ALS Consortia, or NEALS, concluded that any treatment is clinically meaningful when it results in 20 to 25% or greater change in the slope of the ALS-FRSR, reflecting a slowing in functional decline. Based on 3 phase 3 clinical trials, side effects of RADICAVA were generally well tolerated, and the most common side effects being bruising or contusion, problems with walking or gait disturbance, and headache. Now, fatigue was also reported in those patients taking RADICAVA ORS. RADICAVA ORS is an oral formulation of a proven IV treatment. It's approved for ALS in 2022, and it is the only FDA-approved form of oral edaravone. Now, since its approval in 2022, RADICAVA ORS has been prescribed by more than 1,000 physicians, resulting in treatment for over 8,800 patients, probably close to 9,000. It's been very well received by the medical community. Now, in 2024, RADICAVA ORS was recognized by the FDA with orphan drug exclusivity due to its major contribution to patient care. This recognition was based on the RADICAVA ORS oral suspension route of administration, which is less burdensome for patients than the IV administration of the previously approved RADICAVA. From 2019 to March of 2024 this year, RADICAVA ORS is one of 4 medications given this FDA recognition. So no matter where you are in your ALS journey, from diagnosis to treatment, the JourneyMate support program gives you the understanding, answers, and resources to help you move forward. Experienced program team members are trained to address your educational needs and provide you with personalized answers and resources for living with ALS. This program does not provide medical advice and does not take the place of a patient's doctor. Now, perhaps there's no better way to appreciate real-world experience than by hearing someone's personal story. At this time, I'd like to introduce Gwen Peterson, who will share her experience with RADICAVA ORS. Welcome, Gwen.
Thanks so much, Dr. Pattee, and thank you, TPA. It's great to be here, and thanks to everyone in the audience for joining.
I'm thrilled to be joined today by Gwen Peterson. Just an introduction. Since her diagnosis in 2018 with ALS at the age of 32, Gwen has poured her energy into advancing the science of ALS, becoming actively involved in many projects and organizations in the ALS community. So Gwen, thanks for being here today.
Thanks again for having me, and looks like next slide, please.
So Glenn.
So just we're staying on the same slide. Sorry, I'm already messing this up, and we're 2 seconds in, but that's me. So Thanks so much again. My name is Gwen Peterson, as Gary mentioned. I happen to be happily married to my best friend. I know that's kind of corny. His name is Nathan. We are parents of an exuberant puppy. Her name is Annabelle. She is not pictured here, but she is quite a handful. Before my ALS diagnosis, again, as Gary mentioned, I was 32 years old. I was working as a recruiter for one of the top 10 medical centers in the US. Ironically, I was recruiting researchers. So after my diagnosis, we had to move back to my home state of Connecticut because in this disease, we need all the support we can get. So I've got lots of friends and family around me, thankful for that. And as far as what I love to do these days, things look drastically different, but I still love being by the ocean, going to the beach. Actually, next week I have the opportunity to get into the water using a wheelchair sort of floaty contraption. It's going to be amazing. I enjoy walks with my dog on my scooter and really getting outside and taking every advantage, opportunity I can to do that. Thanks, Gary.
Well, thank you, Gwen, for telling us about yourself. It also appears from the photo that you guys are baseball fans, although for competing teams, I see. Now, ALS advocacy is also, I know, a big part of your day-to-day, isn't it?
Yes, huge part. For me, Gary, it's really important that the next 32-year-old woman who gets diagnosed has a brighter path forward, and at the bare minimum is better informed about their disease. I am so lucky to work with a group of younger women called Her ALS Story. And one of the main objectives behind Her ALS Story is to dispel the myth that ALS is an older man's disease. As we know, anyone, anywhere, at any age can get ALS. I am also passionate about advancing ALS research. So I have participated in clinical studies, and I've trained as a research ambassador with the Northeast Amyotrophic Lateral Sclerosis Consortium. NEALS is the acronym. That's a great opportunity. So Gary, everything I'm doing now will hopefully pay off for the next generation of people diagnosed with ALS.
Absolutely, Gwen. Thank you for your passion and dedication to this work. And I'd like to talk to you about what you are doing to help slow the progression of your own disease.
Right. It is critical for people living with ALS to have information up front with their doctor, having those conversations really from day one about all available FDA-approved treatment options. It's important to have these conversations, and we all have to do our research, ask questions, so that we can make informed decisions about our care. When I was diagnosed, my doctor and I decided the best option for me was to participate in a clinical trial. Unfortunately, with that trial, you couldn't be on RADICAVA and participate in the trial. So RADICAVA was exclusionary. From that time, I think as a community, we've made FDA-approved therapies a bit more inclusive in trials, which is great. TPA provided a lot of educational resources in addition to what my doctor provided that helped with some of these informed decisions. There's nothing better as a patient than knowing what to expect, especially from the get-go, and having resources along the way. TPA has done a really great job hosting company webinars that have shared step-by-step the actions needed to be taken to help navigate the insurance access process and the steps necessary to enroll in RADICAVA. They also TPA also provided info about how to take the drug, so the regimen, what to expect from the therapy, and some of the information from the trial and side effects. So really great company-sponsored webinars. TPA also addressed the who, what, where, when, how, and why. And having, again, for me, having that information from the start really set expectations and kind of laid out a roadmap from the get-go. Thanks, Gary.
Thank you, Gwen. That's great to hear your story. Let's explore a few of the things you highlighted in a bit more detail. You mentioned insurance coverage. Can you tell us a bit about your experience with the TPA JourneyMate support program?
Yeah, as everyone well knows on this call, ALS has a significant financial impact on us as individuals, patients, and our families. This is definitely a familial, it affects everyone disease. So I worked with the JourneyMate insurance and access specialist to confirm my insurance benefits and apply for TPA's out-of-pocket assistance program, which reduces significantly my out-of-pocket costs for ORS. And I continue to take advantage of this financial assistance. JourneyMate also offers two other programs, a resource specialist who can provide general info about ALS and RADICAVA, as well as an ALS clinical educator who works with people after they have been prescribed RADICAVA, sharing educational info and resources. Now, I haven't worked with these other two parts of JourneyMate, but I can certainly imagine they'd be helpful for people newly diagnosed or new to ORS. Having support on our journey, whether it's through advocacy organizations or company-provided programs, is so important.
Thanks, Gwen, for sharing your experience with the JourneyMate program. Now let's get into your RADICAVA ORS experience. Can you tell us about how RADICAVA ORS fits into your day-to-day schedule?
Happy to. So the regimen is 2 weeks on, 10 days out of 14, and then 2 weeks off. I can't take it myself, so I can't administer the oral syringe. As a result, my husband gets the syringe ready, oral syringe ready first thing in the morning. It's really easy for him, but he administers the syringe first thing in the morning when I'm barely out of bed. He empties the oral syringe on the inside of my cheek, and then I wait 1 hour before consuming any food. And the hour flies by super fast. After that, I go on with my day.
Great, Gwen. Thank you for that description. Let me now back up and share a little bit more about the dosing and administration for RADICAVA ORS. As you mentioned, Gwen, RADICAVA ORS should be taken in the morning on an empty stomach after an overnight fast, and no food or drink should be consumed except water for 1 hour after its administration. The drug is given with a syringe, which can be emptied into the cheek or placed into a feeding tube. In terms of the treatment schedule, because Gwen has been on therapy for some time now, she takes RADICAVA ORS for 10 of 14 days, followed by 2 weeks off. Yet for people starting RADICAVA ORS, the first cycle of treatment requires 14 days of therapy, followed by 14 drug-free days. Now we know that everyone living with ALS is different and is going to have a different experience with therapy. But Gwen, how do you think RADICAVA ORS is helping you?
A great question, Gary. And truthfully, I can't answer that with 100% certainty because I don't know what my progression would look like without RADICAVA ORS. Certainly, it's not a curative drug. No one is here saying that it's a curative drug, but in my opinion, it is an important tool in the toolkit for someone with ALS. And again, administration is really simple. For me, it's important that I understand the data for any of the medicines I take. And I think the data for RADICAVA ORS is strong and compelling. Of course, I discussed the data with my neurologist, again, right up front, pretty much from day one. As new studies in ALS have come out, she has encouraged me to only continue with RADICAVA ORS. For me, my neurologist and my care team, they are extremely well informed. I'm very lucky. Their insights are invaluable and give me confidence in my treatment plan. So whoever your ALS specialist is, I certainly recommend keeping the lines of communication open. Please ask questions. If you are on ORS and you think you are experiencing a side effect, please talk to your doctor. Thanks, Gary.
Well, thank you, Gwen, so much for sharing with us today your experience with RADICAVA ORS. I'm sure now that the group here may have lots of questions for you, so perhaps we can open up the floor for questions at this time.
Thanks, Dr. Pattee. And yes, a number of questions have been coming in online. So we'll just start to get in them, but I appreciate the presentation. So the first question from the audience, as progression is different for everyone, how can we know that slowed progression is related to RADICAVA?
Well, I'll be happy to kind of jump in on that. The honest answer is we really don't for each individual person. That's why we run these phase 3 clinical trials, and that's why we use a placebo wing when doing so. In other words, we have to match the treated group against an untreated group over a fixed amount of time to see if one group outperforms the other. Now, for each individual person, as I had mentioned, it can run at a different time course, but that's why when these trials enroll patients, they enroll patients that oftentimes have different rates of progression. So the best answer is with any clinical trial, when we can identify an objective measure, which in this case is a change in the slope of decline of a validated ALS ranking scale, that is I think that's very important, and I think that alone is evidence that this drug is worthy of at least giving it a try to see if it has an impact on the slowing of the progression, and that's what we're really trying to achieve.
Thank you. That's super helpful. So the next question is gait disturbance a side effect of RADICAVA? Is this common? And so what I'll say before I turn it over to Dr. Pattee is always, talk to your doctor about anything that you think might be a side effect. But Dr. Pattee, why don't you answer from your personal experience?
Yeah, no, and actually from my personal experience, I have not had many patients report gait disturbance. And we talked about contusion, gait disturbance, headache, fatigue as being side effects. Now, these side effects were more common than what we saw in the placebo wing, but they were still overall not that common as in total. So there's probably a number of reasons why that may be the case. Gait disturbance is obviously something we run into with the disease itself. So my own personal experience has certainly not been such that patients with a noted gait disturbance had to stop the medicine.
Jennifer, if I may, would love to ask a question. This is something there's been discussion in the community about the ADOR study, ADOR trial. So Jennifer, hoping you can help here. How does the failed ADOR trial impact RADICAVA ORS? And hopefully you can define the ADOR trial, kind of high level, what happened, and that, if any, impact on ORS.
Actually, I think it's better if Dr. Pattee answers this question, because I'd like the clinician's perspective as opposed to the TPA perspective. So
perfect. That makes sense.
Sure, of course. No, thanks for asking this, Gwen. Well, just a little high level. The ADOR trial was a trial looking at an edaravone formulation, which was not produced by TPA. TPA had nothing to do with this formulation. They have their own formulation of edaravone. Nonetheless, it was run in Europe, and it was run, I believe, over 48 weeks. It didn't show the positive effect they were hoping to see in their trial. How does it affect what we do? Well, simply put, it was not the same edaravone formulation that the TPA company has been working on for the last 2 decades with 3 or 4 phase 3 clinical trials and FDA approval. The TPA formulation, what we have available, the RADICAVA ORS, was found to be effective, and we've got objective data to show that. So overall, it doesn't necessarily change at all my approach. I still find this to be a very effective medicine, and I try to get people started on it as soon as we can.
And Dr. Pattee, just a follow-up. So the ADOR trial, that wasn't an exact carbon copy of the TPA trials, right?
Yeah, Gwen, that's true. It wasn't the same oral formulation that TPA is used. There are different formulations, and apparently there are several other formulations of edaravone that different companies around the world have used. But the TPA formulation, we're fortunate enough to have as the one that's been found to be effective in the clinical trials that have been run, and of course that have been, FDA approved.
Right. Thank you.
Thanks to you both. A good conversation about an important topic. The next question is, when in my journey should I start RADICAVA? I'm going to reiterate before I turn it over to Dr. Pattee, always talk to your personal physician and healthcare team. But Dr. Pattee, could you give your perspective on that?
Yeah, I can. And simply put, my approach is to start early and heavy with anything I have available, meaning when I see a patient that comes in and I've made a diagnosis, I can get them started on Riluzole, which was the first FDA-approved therapy, and then we turn in the paperwork at the same time for RADICAVA. Since it has to oftentimes get a prior authorization, it takes a little longer to get it started. But as we kind of mentioned briefly, over 90% of the patients in these TPA RADICAVA trials were also on Riluzole. So we have data suggesting the combination is effective. And for that reason, I like to get both of these agents started as soon as I can.
And Gary, just add a little color. That's exactly what my clinic recommended for me. I'm not saying that is the right path, just Gary's path as a provider, and in his clinic, that was exactly how it sort of rolled out for me. Riluzole was given immediately prior auth for ORS. And then we got the ball rolling from there. So just my personal experience, but it does match Dr. Pattee's.
Yeah, and Gwen, just to follow up on that, as a rule, there really is no reason to wait. If we have a medicine that has an effect on a disease process, the sooner we get it started, I think, the better we're going to see some impact. So I'm all in favor of starting it as early as the diagnosis is established.
Great. Thank you both. The next question is, again, for Dr. Pattee. How do you manage genetic versus non-genetic forms of ALS?
Okay. Well, that's a little outside the scope of this presentation, but I'm happy to jump into it. Here's how we manage it. Number one, I personally will get genetic screening on any patient that I diagnose with ALS, and for good reason. We have a treatment now for SOD1 mutations that anyone with that mutation should consider being on. And for that reason, we like to screen everyone. In terms of managing the patients, apart from oftentimes the genetic form of ALS presenting at an earlier age of onset, the disease is almost identical in terms of how phenotypically or how the disease is expressed in clinical symptoms. So we really can't look at a patient and say, aha, you have the sporadic or you have the familial form. That wouldn't be something we'd identify just on the exam. So we manage them the same is the bottom line. If there's a SOD1 mutation, of course, we're going to go at that a little differently because we're blessed to have another product out there we can consider using. But in terms of day-to-day management, we do our best for whichever form they present with.
Thank you for encouraging genetic testing and genetic counseling. Really important. Thank you.
Yeah.
So a question for you, Gwen. How does taking RADICAVA ORS fit into your life?
It fits into my life, although I can't squeeze the oral syringe in my own mouth. My husband / caregiver does it for me. It's really easy for him. And as mentioned, I'm not even out of bed. I've got like one eye open and I take it straight away. It sort of it starts my day. And then I wait 1 hour before consuming any food. For me, it is tasteless. So again, for me, everyone's sort of different, but it is tasteless. So it is not a hindrance on my lifestyle really at all. That's a great question, by the way, because our time is precious.
I couldn't agree more. Thank you. So next question is about side effects. And I know it was covered in the presentation, but perhaps Dr. Pattee, you could just talk a little bit, just review the side effects of RADICAVA.
So some of the things that we concern ourselves with would be allergic reactions. So we talked a little bit about these bisulfite ingredients within the RADICAVA product. So that is one concern, especially if one has asthma. And so that's why that was emphasized early in the talk, that if you do have asthma, which is a reactive airway disease, be sure to talk with your doctor about that. And before starting the product, get as much information as you can. Sometimes, in fact, if there's an asthmatic history, having, taking your first dosing of the medicine, maybe in your doctor's office is not unreasonable, just so that they can monitor your progression. As we mentioned, the bruising, the contusion is not something that we saw in a lot of our patients, but it was maybe the most common side effect of the series that I reported on, that was that the patients at least explained was happening. The balance, some of the headache, the fatigue, these side effects can be a consequence of the underlying disease process to some extent as well. So that makes it a little more challenging. We did have some patients, because it does have a fructose component to it. If they have a fructose sensitivity, we had to be a little careful, and we had to at least warn them about that as being an issue. Those were really the only major issues that we had with side effects. It was tolerated very well, as Gwen had mentioned, and I don't think we had any patients stop the RADICAVA ORS because of any side effect they were experiencing.
Great. Thank you for sharing both the side effects as well as your personal experience. Question on, can you drink coffee before your 1 hour is up post-dosing? Dr. Pattee, do you want to handle that? Otherwise, I can.
Oh, it's so funny. I think the honest answer is we probably want to try to avoid anything that isn't just simply water, simply because we don't know if the caffeine might interact with the product and potentially impair its absorption. And that's really the whole issue here. It's not like the coffee is going to harm a person, or food for that matter. It's being sure that the product is being absorbed properly into the system. And we have other medicines that we have the same concerns about. It has to do with just the oral absorption mechanism. And we want to be absolutely sure that there's no product in the stomach when food comes, because the food can bind the medicine, preventing its absorption and just taking it right outside the body. And so that's the reason we try to hold off on anything but water for at least an hour. Everybody's GI motility runs at different rates, but usually by an hour, everything's pretty well emptied.
Yeah, and great question about coffee. Is certainly important. So that's a big part of the reason why I still take it when when I've just sat up in bed. I'm not ready for my cup of coffee yet, so I take it first thing. That hour flies by, and then I'm ready for coffee. So I take it very first thing.
So the next question, it's kind of along the same vein. Can I shake the bottle and draw the medication into the syringe the night before so that I can take it quickly in the morning and go back to bed?
Yeah, that actually is a question I'm not sure I can answer. That might be something I would pass on to the TPA pharmaceutical teams to see what their responses are. I think with any product, you want to reduce the risk of sedimentation, and it can kind of settle a bit in the syringe. Furthermore, you want to make sure all of the product is evenly distributed. And so by making sure it's freshly shaken when you administer it, I think you probably have the best chance of getting the full impact. But I'm sure the pharmaceutical team could maybe comment further.
So what I would say is really it should be used as directed in the patient information. So really, I wouldn't recommend doing it the night before. So.
Jennifer,
yes.
regardless if it's shaken the night before, which you're not recommending, it does need to be shaken right before use, right? Only necessary as it's used, correct?
Yeah. Yes.
Okay.
Thank you. Absolutely. And I appreciate it. I know we're starting to run short on time, so we probably won't get to all the questions. And also there are some questions that can't be answered in this forum. And I would recommend if you've got questions kind of specific like that, it's great to go talk to your doctor specifically. A couple more to squeeze in before we end, and then I'm going to close us out. So why can't people with respiratory problems qualify for RADICAVA? Dr. Pattee, do you have
well, the answer is they should be able to qualify for RADICAVA. When the FDA approved this compound in 2017, there were no restrictions on respiratory cutoffs. The FDA made this available for anyone with ALS or motor neuron disease. The honest answer is there is no restriction that the FDA imposed upon respiratory cutoffs for use of this agent.
Great. Thank you. Thank you so much. Just a few more. Dr. Pattee, do you have patients on RADICAVA for a long time? Is it a forever treatment is the question.
The answer is when we start medicines like the RADICAVA, the Riluzole, we do a lot of clinical research trials as well. We try to keep people on as long as we possibly can. And it's because this is a progressive disease. We're just trying to slow that progressive rate and hoping that the next trial that comes out will be the one, a trial that will really make an impact so that patients are doing as well as possible for as long as possible. So it's not something that you just try it to see if it's effective. It's something that we put on board in an attempt to slow down the progression of this disorder. And that's what the studies have shown. And for that reason, I try to keep people on medicine for as long as they can continue taking it.
Great, thank you. And then final question, can you explain a little bit more of what it means for RADICAVA ORS to be recognized by the FDA as a major contribution to patient care?
Yeah, so this is something that I believe there's only, the last couple of years, there's only 2 medicines that the FDA has recognized under that category. It, in essence, is recognized by the FDA because of its ease of administration, its portability. It's, as Gwen said, simple is better with any disease, this one in particular, so that apart from its prior usage, the intravenous form, where individuals sometimes had to go to an infusion center or have infusion nurses come to the home or have family members give it to report, this is a product they can give to themselves under the quiet of their home. It's transportable. They can bring it with them. It's not a major issue in airports. So they found this to be a very convenient method of administering an effective medication. And for that reason, I believe is how the FDA was able to recognize it as one of few products with this recognition.
Thanks, Dr. Pattee. Gwen, do you have a perspective on it?
I completely agree with everything Dr. Pattee just said. It's a huge part of the sort of 3 reasons why I take this. One, the data I feel and my neurologist feels is very sound and compelling, solid. Two, it's to Gary's point, it's accessible. So, to Gary's point, we don't need a note when passing through an airport. And three, fits into my lifestyle so well, pretty low maintenance. And again, everyone on this call, our time is precious, and this is something that's not very time intensive, though. So thank you.
Thank you. I appreciate both your responses. I also appreciate the time you took to present today. Thank you for being a part of this. I'd like to thank the audience for joining us today and wish you all a good rest of your day. Thank you so much.
Thank you, Jennifer.
Thank you.
Indication: RADICAVA ORS edaravone is indicated for the treatment of amyotrophic lateral sclerosis, or ALS. Important safety information: do not receive RADICAVA ORS edaravone if you are allergic to edaravone or any of the ingredients in RADICAVA ORS. Before you take RADICAVA ORS, tell your healthcare provider about all of your medical conditions, including if you have asthma, are allergic to other medicines, are pregnant or plan to become pregnant. It is not known if RADICAVA ORS will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if RADICAVA ORS passes into your breast milk. You and your healthcare provider should decide if you will receive RADICAVA ORS or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of RADICAVA ORS? RADICAVA ORS may cause serious side effects, including hypersensitivity or allergic reactions, and sulfite allergic reactions. Hypersensitivity reactions have happened in people taking RADICAVA ORS and can happen after your medicine has been taken. RADICAVA ORS contains sodium bisulfite, a sulfite that may cause a type of allergic reaction that can be serious and life-threatening. Sodium bisulfite can also cause less severe asthma episodes in certain people. Sulfite sensitivity can happen more often in people who have asthma than in people who do not have asthma. Tell your healthcare provider right away or go to the nearest emergency room if you have any of the following symptoms: hives, swelling of the lips, tongue, or face, fainting, breathing problems, wheezing, trouble swallowing, dizziness, itching, or an asthma attack in people with asthma. Your healthcare provider will monitor you during treatment to watch for signs and symptoms of all the serious side effects and allergic reactions. Common side effects reported include bruising or contusion, problems walking or gait disturbance, headache, and fatigue. These are not all the possible side effects of RADICAVA ORS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to www.fda.gov/medwatch or Tanabe Pharma America Inc. at 1-888-292-0058. Please see the full prescribing information and patient information available at www.radicavaors.com.